Hello, good afternoon, everyone. It's nice to have everyone here. So I'm going to assume everyone on this call today is part of a team. So please reach out to your team members, have them join the call. It's very important that everyone is here. So reach out to your team members and have them join the call. Rodiat, I can see your hands are raised. You can just please drop a message in the in-call messages. It will be read from there. Also, it's important that you please join with a mail that carries your name. This is for attendance purpose. So please, it's advised that you join with an email that carries your name, your full name, not a nickname, not a shortened form of your name. This is to make sure that you do not miss out on the attendance. So kindly reach out to your team members and have them join the call. Thank you. Hello, once again, everyone. If you can hear me, kindly send in your reactions so I can be sure you all can hear me. All right, thank you. All right, all right. So we're going to be starting very soon. So once again, kindly reach out to kindly reach out to your teammates and make sure they are all on this call, sending reminders and every other thing. Make sure they are all on this call. Okay. And if anyone is having any issue joining, just tell them to speak up on the group chat. There'll be someone to attend to them on whatever issue they may be having. Okay, now we are running a bit behind schedule just to make sure we can get everyone on this call as much as possible. So once it's 4:15, the meeting is going to kick off. This is to make sure we do not keep our speakers waiting. Everyone's time is precious and important. So kindly reach out to your teammates and have them join the call. Okay, so this is just to provide some clarity about the settings of the meeting. You may have found out that you're unable to unmute yourself or you're unable to turn on your camera. That is very intentional and it's based on the settings of the meeting. That is to make sure that we do not have any interruption as the meeting goes on. And for the speakers, when it's your time to speak, you're going to be given the host right. So this allows you to turn on your mic and turn on your video. Thank you. Okay, so once again, good afternoon, everyone. Trust we all are having an amazing day, and I'm sure I hope everyone on this call is as excited about kicking off this initiative as I am. I hope everyone is as excited as I am, because when you've put in so much effort into something, you want to see it succeed. And it's not just about the effort, it's about the impact you're hoping to make. And we're so happy to have you with us on this journey. We are so happy to have you as a part of this initiative. We all appreciate the commitment you've taken, the bold step you've taken to be a part of something this great. So before we move on in the meeting, I would like to introduce some dignitaries amongst us today. And with your emojis, as I'm calling these people, I would like you to react to your favorite emojis, the clap emojis, and all of that. With us today, we have the #1 medical students in Nigeria, the 48th executive president of the Nigerian Medical Students Association, Mr. Amadu Sadauna. We have him with us today. Also with us, we have the National Director of the Nigerian Medical Students Association, the Committee of Emergency Response and Advocacy, Ms. Christine Ferdinand. Also with us today, we have the founder of EOhealth, the organization hosting this in partnership with NiMSA. We have with us the founder of EOhealth, Mr. Owolabi Emmanuel. Also, we have with us today our keynote speaker, a Princess Diana Awards holder, Mr. Praise Ogunleke. So to officially give us the welcome address and introduce this training to us, to formally give us the welcome address and also give us a brief introduction about the virtual health literacy and emergency response training, I would like you all to welcome with me Mr. Owolabi Emmanuel. So you're welcome. You should be able to speak now. We'd love to hear from you.
Thank you so much. Please, can you hear me clearly?
Yes, we can.
All right. Thank you so much, everybody. So my name is Emmanuel Owolabi. It's with all pleasure to be here with everybody. First, let me follow the protocol. Let me appreciate and recognize 48th the NiMSA president, President Sadauna. Please let me appreciate him so much. It's with much excitement to have been able to have this initiative approved by him to work with NiMSA and to reach fellow NiMSA like myself to bring up this particular initiative. And of course, my very much reverend director of NiMSA ERA, that is person of Ms. Christine. Thank you so much once again for making this possible. At the same time, I would like to also appreciate our keynote speaker for today, Vice President of Press of the UK, and so much respected person, a leader, and a social impact leader, as much as we can say. And thank you also, our program director, the person of Samuel Olaliko. Thank you so much for this moment. I'm excited to be here with everybody to deliver this very brief talk to you, to introduce to you what this program is all about. So this started as a quest for health literacy as an organization that champions health literacy in the very best that we can do. But at the same time, we looked at, after much, let's say, we call it survey now, of the need to reach out on the self communities to empower medical students or medical professionals just like myself. We saw that this is to be very important or needed to help those that might be very interested in this as well, health literacy, to know how to go about them the right way. And therefore, we looked at a program that will make this possible, as much as be able to have more champions in banking and going against as many misconceptions that we have right now when it comes to health education, all right, so that we can go out there and lead health education as much as we can. So every individual here at the end of this particular program is expected to be able to contribute to their society, their community, as much as they can. All right, so it's all start from us. At the same time, how much can we do? How much can we intervene in as many emergencies that we find amongst us? There are a lot of emergency cases or issues or cases that we can consider emergencies, right, that we find amongst ourselves or even our communities that we experience. But however, we often, because we are still medical students or something, we often realize that we have little or no knowledge to how to harness or provide solutions, at least assist or intervene in situations where we realize that some persons are going through emergency situations that could have been averted if only we are able to intervene or have enough knowledge. So this is supposed to provide you that much information for you to next time when you find yourself in that emergency situation to be able to know what to do. All right. So to call it open, I would say well done to every one of you who have been able to register for this particular training, and I really wish every one of us well, and I hope that you all be utilizing this knowledge to leading your communities in as much as possible knowledge that you've been able to garner in this particular training. So thank you so much. For now, that'll be all I'll be saying. Thank you, everybody. Yeah.
Thank you so much, Mr. Emmanuel, for that. I'm sure what we've heard, the brain behind this initiative should be enough motivation for you to be committed. It should give you an understanding of what this program is about and what you should expect from it, and also what we should be expecting from you. So coming up next, I would like to invite for our opening remarks and appraisal, I would like to invite, like I said earlier, the #1 medical student in Nigeria, the 48th executive president of the Nigerian Medical Students Association. With your emojis, join me in welcoming Mr. Amadu Sadauna. Sir, I would be giving you host rights now so you can unmute your mic and speak. Sir, you have the floor.
Okay, thank you so much, ladies and gentlemen. Compliments of the hour and compliments from the Nigerian Medical Students Association National Secretariat at the prestigious Ahmadu Bello University Teaching Hospital, Zaria. Before I continue, can someone confirm if I'm audible enough?
Yes, sir, we can hear you clearly.
Thank you so much. So the distinguished leadership of EOhealth, the organizers of this remarkable event, the leadership and subcommittees of the Nigerian Medical Students Association, and to the lady that is championing the affairs and an interface between NiMSA and this organization in person of Christine, who is the National Director on NiMSA for Emergency Response. We have brought this body and established this National Directorate family because of one or two things and ideas that have happened over time that wasn't pleasant to sight, wasn't pleasant to hearing, and it wasn't pleasant to our understanding. A lot of times I have walked around and we've seen clashes, accidents, etc., fire burns from home to offices, from schools to churches to mosques, at playing grounds, at filling stations, etc. But what people end up doing in that place is not devising an immediate means to try to have access to care for multiple casualty patients in the site of injury. What they do is end up snapping a lot of photos, uploading online. The The content creators are using it to create content, etc. And before the health intervention or strategy is established, people have died. We've lost a lot of lives we are supposed to be saving on the course of trying to make those photos. Then when I summarize most of these lessons, I started it smaller when I was the regional coordinator for NiMSA Northwest. We had it very robust. I had allies all across the 6 regions. And I think during the days of President Webster, it stood the test of time because I had to explain the rationale behind why we needed to create it. I need to back it up with substantive evidences because as NiMSA, as medical students, as people who want to contribute to the intellectual capacity of the society we find ourselves, ideas like this need to be paramount and need to be nurtured. So becoming the president NiMSA in Nigeria, I believe it is only wise to bring it up. We were affiliated then to the Nigerian Red Cross Society national body and all its state chapters, and the Nigerian Emergency Management Agency, NIMA. We were also affiliated to the WHO, United Nations, to the Department of Emergency Response. But as time moved by, we've seen that there is little advocacy and little that has been done in aspects of those emergency response. That's why when Dr. Emmanuel reached out and told me that this organization, EOhealth, is not only committing to uplifting excellence in the process, but also has the resources and the manpower to ensure that NiMSA is partnered with and the right lessons passed across to people who have been victims of circumstances like this. So we can save lives because most of these things does not ring any bell. Most of these things are things like we call them accidents. And it could be me, it could be anyone, God forbid, it could be our uncles, our aunties. What we do at that point might be the turnaround for the rest of that person's life. And the decision we take at that time, we must understand that life depends on it. And the decision we take and we take wrongly, if posterity should judge us, it might be in a way that we will not forgive ourselves for not getting the right lessons, not getting the right intellect, and not getting to save lives as and when due. So as president of more than 80,000 medical students at home and abroad, I have welcomed that initiative brought by Dr. Emmanuel with all my heart. I have redirected all the affairs of the office to the National Directorate. I have made NiMSA more aware. That's why if you see today, we are here in our good numbers. We are here because it's something that is one of its kind. And I respect the entire publicity and the entire organization. Like it's very organized program, kind of. People reach out time to time requesting things should be done like this, and the sequence of events that happened prior to now is what I believe will forever earn EOhealth the respect with NiMSA Nigeria till the end of time. So while I sincerely appreciate other keynote speakers, Mr. Praise Ogunleke, forgive me for the pronunciation if at all I have heard, and the program coordinator, Mr. Olaleka Samuel, who is always on my mail, and Mr. Olabi Emmanuel, who is the founder, and any other person that has come to this event today. We are here because all of us want to put our hands together and make the difference. And I hope in the things and the decisions we are going to all come up with today, it's what is going to serve NiMSA and change the face of affairs till the end of time. I will encourage the medical doctors here, the medical students here, our affiliates from other departments, nursing, pharmacy, because I have sent link all across. So I can see a few of my friends from my sister departments here. I will advise us to respectfully hold on to these ideas, ensure that the commitment outside there is paramount, ensure you adequately go through all the subsequent classes that will be available to you, And because all these things happen in healthcare settings, fires can break out in laboratories, in the nursing station. We don't pray for that, but there are things that we need to prepare. I have written an article before, preparation for emergencies. So none of these things rings a bell. So once it does, it doesn't overwhelm the capacity of individual to think, and it shouldn't overwhelm our capacity to contribute positively. So most of these things are things that whenever you want to consider an international opportunity, it will give you that time. If you give to, it will equip you with the right resources to contribute back on the affairs of things. So while I thank all for having me today and to having the Greater Nigerian Medical Students here, I wish us a fruitful deliberation, and I respect whatever it is that we'll come up with. And should any one of us need NIMSA Nigeria in any of our affairs, we are ever willing to avail ourselves, avail our manpower, avail our intellectuals to contribute back positively to things like this. Long live EO Health, and I hope that the partnership we've started and the understanding we've established can only stand the test of time, and we can only continue to keep nurturing things like this till the end of time. And good news is, for the few opportunities I've gotten to interact with people, NIMSA will not only sit down to keep benefiting from what you present, but will also contribute our quota to the external relations we have established in less than 2 weeks. A lot of information have been coming in, and I believe at the decision will all come out readings of today's program. Let it proceed remarkably. Thank you so much for having me, and thank you for the opportunity you have given NIMSA Nigeria. I wish us a happy and successful deliberation.
Thank you so much, sir, for that wonderful opening remark. I'm sure if you listen very carefully to all what Mr. President has shared with us, you should see why this is very important. Right from when the committee was vetted, the reason behind the committee being given birth to, for the committee being created to this initiative, you should see that there is a connection between everything, and this further moves forward the main reason why the committee was created. So I want you all to, with your emojis, appreciate Mr. President for the wonderful speech and insights he just shared with us. Thank you very much, Mr. President. So without further ado, I would like to introduce a wonderful woman amongst us today, a wonderful leader, I must say. Allow me to introduce the National Director of the Emergency Response and Advocacy Committee under the Nigerian Medical Students Association, NiMSA-EOhealth, Miss Christine Ferdinand. Ma, you have the floor now and you can speak.
Okay, thank you very much. Thank you very much. It's a pleasure to be here. Good evening, everybody. Maximum respect to the NIMSA president, the 48th NIMSA president, the founder of the EO Health, Emmanuel Owolabi, all the team members of EO Health, and all members of the NIMSA era, the keynote speakers, and every participant here in your respective capacities. I recognize you all, and I must say it's a thing of honor to be able to speak in this webinar. Thank you so much for having me. The president has said quite a lot, so I'm just going to buttress what he said. I'm just going to be very, very brief. So I'm sure by now the participants are already aware of the purpose of the training that is to come up, the virtual health training. I'm just going to give a little insight on what the NIMSA era stands to achieve. The NIMSA era fully means NIMSA Emergency Response and Advocacy Team. And I want to thank in a very special way the NIMSA presidents for this initiative, for being able to come up with the idea of creating such a team. Our relevance cannot be understated. One of the reasons why this partnership has come to bear and why this program is being organized for the respective participants. So the aim of the emergency response and advocacy team is to provide certain measures on how we act in critical health situations. And then when it comes to advocacy, how exactly can medical students use their voices and their knowledge to influence or change certain health systems or certain norms with regards to the health space. Now, what is really the relevance of all this involvement? One, it's very important to note that we are the future of the medical system in Nigeria. So if we are able to influence certain decisions at the level of students, then it creates a thriving future for the healthcare system of Nigeria in general. So for the purpose of this upcoming training, it's essential that med students should be able to know basic skills with regards to emergency response, basic skills like CPR, at least first aid in terms of bleeding, burns, fractures, maybe on campus or in mass casualty events. Basically, safety skills too. At least it's best these havocs are prevented. So safety skills are very, very important to be learned. And in the case of these emergencies, how can medical students respond if there's someone bleeding, if there's an accident scene, if there's an epileptic patient having a seizure, if there's a drunk person around you, how exactly do you assist? Yeah, medical students, would you say, oh, this person is bleeding and you step away? How exactly can medical students come in? That's the purpose for these events, and that's one of the core values of the NiMSA era. So I think once again the management of the EO Health, it was very joyful that they had to reach out to us for this partnership, and I believe that a lot is going to be transmitted in terms of knowledge to all the participants. So please, I will urge all participants to try to be committed to the course, try to be present always, try to learn everything that's going to be taught by the different speakers. Like I said earlier, I was going to be very brief. I had a class and I had to sneak out. So please, that's basically what the NiMSA era is all about. I will also urge all participants to be part and parcel of all our events. The NiMSA era has more to offer. I hope there's going to be more partnerships. I believe there's going to be more partnerships with the EO Health. So there's more that we have to offer. So do well to watch our space, do well to be involved in all our activities. And at the end, we have just one goal: for a review of our healthcare system, for an upgrade in the skills that medical students ought to have. So thank you very much, management of EO Health. Thank you to all the keynote speakers. Thank you to the NiMSA president. Without you, the NiMSA era wouldn't have been in the first place. So we appreciate you, and to all the participants, I wish you well. At least at the end of 6 weeks, a lot should have been gained. So thank you very much, everybody. Thank you.
All right. Thank you so much, Miss Christine. Miss Christine, for that very wonderful address. I think that further reinforces what we've been hearing since morning. What is since the call started? What is the purpose of what we've come here to do? Like the whole training, what is it about? And now you see the importance of having emergency response skills. Like you're medical students, if something happened outside there, say maybe someone fainted, maybe there's an accident and there's someone massively bleeding, they're like, okay, what can you do to help this person? Imagine now everyone knows there's a medical student, then they're like, what can we do to help this person? And you, so you're just there standing helpless. You don't want to be that person. So I actually appreciate Miss Kristen for what she has just shared with us. Thank you very much, Ma. So moving on with the program of the day, with us today, I would like to now it's time for the keynote address, and it's by someone I really enjoy listening to. Like, there is absolutely no time we've met or I've been in a meeting where he's sharing that I don't find his message very impactful. This is someone that I really admire, and every time I get to listen to him, I'm always very impressed and impacted. So I would like to introduce to us today Mr. Prince Ogunleke. Mr. Prince Ogunleke is a doctor in training. Sorry. Mr. Prince Ogunleke is a doctor in training at the College of Health Sciences, Ladoke Akintola University of Technology, which we all know as LAUTECH in Ogbomoso, Nigeria. He has interest in medical research, public health advocacy, leadership, and driving social change. Prince is committed to advancing healthcare through research, technology, innovation, and advocacy to promote sustainable development and health equity globally. He currently leads the Ogbomoso Health Summit. While I'm reading this, can we all please be reacting with our emojis? This is a very wonderful man to listen to. He currently leads the Ogbomoso Health Summit, a strategic convening of policymakers, industry leaders, and key stakeholders from both the public and private sectors. The summit serves as a platform for sharing innovative solutions that can be integrated into Nigeria's healthcare system to strengthen and optimize it. Motivated by a desire to solve healthcare challenges in Africa, Prince's research interests lie primarily in public health, particularly non-communicable diseases and antimicrobial resistance. He has authored publications in international peer-reviewed journals. He has successfully led healthcare projects supported by AstraZeneca, the National Agency for Food and Drug Administration and Control, and the Nigerian Medical Students Association. In recognition of his exceptional leadership and contributions to youth development in Nigeria, Prince was honored with the Diana Award by the British royal family. This is the highest accolade a young person can receive for social action or humanitarian work. So I'm sure you can bear me witness that today we have with us a very powerful man. And today, Mr. Prince Ogunleke will be giving us the keynote address on the topic Beyond the Stethoscope, Leading Healthcare Change in Your Community. So please, let's make him welcome with our emojis. Let's put our hands together for Mr. Prince Ogunleke. Sir, you have the floor.
Hi, everyone, and good evening today. Please, I'd like to confirm if you can hear me clearly.
Yes, sir, we can hear you clearly.
All right. Thank you very much for that warm and enthusiastic welcome. I am very grateful. First of all, I'd like to appreciate the leadership of the EOhealth team. I think they're doing something very incredible. And I'd like to appreciate like all the leaders in the house today. I'd like to appreciate the NiMSA president in person of Mr. Amadu Sadauna. I'm not sure if I got it correctly, but I'd like to apologize if I made a mistake. I also like to appreciate the national director of the NiMSA emergency response team in person of Ms. Christine Ferdinand, and I also like to appreciate Mr. Samuel Olalikon as well, and everybody who has put this together, the founder of EOhealth, Mr. Olabi Manuel, and everybody who is here today. Thank you very much for having me. I'm really excited to do this. I think that this is really critical in addressing major healthcare issues in our communities, and even in our country, right, as a whole, because I believe that medical students are major stakeholders when it comes to like addressing healthcare issues, and that's why this session is very It's very, 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 very critical. It's very critical. So I'm really excited to be here. I'm really excited to be here. Today, my talk is going to be centered around how to lead healthcare change in your community. How to lead healthcare change in your community. I'm aware that most of us here are medical students or medically inclined, or let's say like healthcare inclined. Personally, I believe strongly that anybody who wants to contribute to healthcare does not exactly have to be studying a health-related course, right? So I believe that even if you have people on call who are not exactly studying what is health-related, as long as you are interested in addressing the healthcare problems, contributing your quota, I think that there's a lot we can achieve, right? There's a lot we can achieve, right? And I'm just going to be going through a few things that I feel are very critical for us to have good grasp about, especially when it comes to leading health change in our community, right? And because of the peculiarity of the audience, I'm going to be making it very relatable and practical so that we can understand how to move from here. Yeah. So thank you very much. So the first thing I'd like to really emphasize is that for you, before you can say that you want to create change, right? I believe that, if you go on LinkedIn, for example, or if you look at people's bios, a lot of people use the word change maker, right? Change maker. A lot of people say, oh, yeah, change maker, which is very good, right? Which is very good. Definitions are very important, right? And a lot of people who call themselves change makers are not exactly creating change, right? Before we can say that somebody is creating change, right? Especially in this context of healthcare, there are a few things that are very critical to pay attention to, right? And I'm going to just go through some of those things. The first thing is that it is very critical to understand the problem that you are trying to solve, right? Because if you want to create change, it means that something is probably not working well and trying to improve the situation of things, right? Or maybe something is working well and trying to make it better, right? So you want to understand very well, very critically, the problem that you're trying to solve, right? So if you're trying to lead healthcare change in your community, it's very critical that you understand the exact problem that you are trying to solve. And I think I need to re-emphasize this. Many times when especially students want to solve problems, healthcare problems and all of that, a lot of people think that solving healthcare problems is just about you it's just like you're trying to cut the stem, you're just doing quick fix, right? Before you can say that, oh, you are really you are creating a solution to a problem, there are a few things that must be part of your solution, right? Number one, your solution must be systemic, right? It means that it must be addressing the problem at the root level, right? It must be addressing the problem at the root level, and that's very critical, right? And then your solution also has to be replicable, right? For example, I'm sure that some of us here, if not many of us, are very familiar with healthcare research, and there's a part of healthcare research that has to do with methodology. And the reason why we have methodology is so that we can replicate a study that's been conducted, right? So for example, if we conduct a study here in Nigeria and then we want to replicate that same study in let's say Kenya, for example, my methodology or our methodology in Nigeria could be adapted, right, to conduct a similar study in that country, right? So that is very important, and I want us to start thinking about some of the problems that we're probably trying to create solutions to. I know that many of us have diverse interests. Some of us are probably interested in infectious diseases. Some of us are interested in maternal and child health. Some of us are interested in mental health. And I want you to really just have this perspective from now that when you want to solve a problem, right, are you really solving the problem from the systemic, from a systemic level? That is very, very critical. And then like, is it replicable, right? How you are solving the problem? Is this something that can be adopted in other places, in other countries of the world, in other communities, right? Because change should actually create sort of like a ripple effect, right? Such that when you create change here, it could be replicated, right? So you want to also carefully pay attention to that as well, right? We want to really like pay attention to that. So, like I was saying, you want to really understand the problem that you're trying to solve, right? Many times people just pick a problem and say that, oh, you just want to solve the problem, right? For example, I've seen a lot of initiatives that focus on, on reproductive health and all of that, and then some of them go to schools to distribute like parts and all of that, which is a very, very good initiative. But then like you want to really ask, like, are we solving this problem at the systemic level? And then like our solution, this kind of solution that we're creating to this problem, is it something that is replicable? Is it something that is replicable? Those are very, very, very critical. Those things are very, very critical, right? So when you understand the problem that you're trying to solve, you need to be able to identify the gaps, right? There's almost no problem that you're trying to solve that, there are no efforts already being made in that direction, right? So you want to understand, okay, the solutions that have been created prior to now, what are the gaps? What are the things that could be better, right? What are the things that could be better? What are the things that could be improved upon? Those things are very, very important. So, for example, if you're trying to solve a problem, if you're trying to solve, let me give an example. Let's say you're trying to address the problem of maternal and child health in your community, right? So, for example, you could check. You want to do like some form of research to understand what solutions. First of all, you want to understand the problem. That is very, very important. So you want to understand what exactly are the things causing the problem, and you want to streamline into your context. Like, what exactly is causing maternal mortality, for example, in my own community, right? And that could be due to a number of things, right? It could be due to like sociocultural factors. It could be due to medical factors. It could be due to health service factors. So you want to check. Okay, for example, we're trying to solve the problem of maternal mortality in Nigeria, but I want us to be specific right now. We're trying to solve the problem of maternal mortality in, let me say, in Makoko, right? Lagos State, right? So we want to check, okay, what exactly are the causes? What are the factors responsible for maternal mortality in this community, right? In this community, right? So, for example, it could be that, it could be due to maybe harmful traditional practices. For example, it could be due to ignorance, right? It could be due to like poor nutrition, right? So you want to really understand that, and why this is very important is so that you'll be able to streamline your solutions such that you're not just solving a problem and at the end of the day you're not addressing the real problem, right? Because, for example, if you think that the factors that are responsible for maternal mortality in Makoko is similar to the factors responsible for maternal mortality in Kaduna, you might be wrong, right? So, and that's why you need to conduct some sort of like a community health assessment, right? A community health assessment. And what that does is that it gives you very comprehensive information about like the healthcare problem that you're trying to address in that community. It gives you information about the needs of that community and other factors that you need to really put into consideration if you're trying to solve that problem, right? If you're trying to solve that problem. So that is very important. That is very important when you're trying to create solutions, or when you're trying to address a particular problem in your community. That is very, very, very important. That's very important. So another thing, which is like an extension of this, is that you want to really understand, okay, what are the needs? I was talking about like the community health assessment the other time, right? So you could do this through a number of ways, right? For example, you could decide to go the quantitative, you could decide to like get data, right, through the quantitative means, right? So for example, you want to maybe conduct surveys, you know, so you could get some data from there to better understand the causes of maternal mortality in your community. That is very important. And then you could also decide to go the qualitative way. So you could, for example, conduct like interviews, you could conduct focus group discussions and all of that, right? That is really important. That is really important. So that would help you to understand, okay, you know, what exactly is responsible for that particular problem in your community. I should also really understand this, right? Because like I said, when you're trying to profile solutions to a problem, you want to ensure that you're profiling solution to the root cause of the problem, right? And you also want to ensure that you focus on what is priority to the community at that point in time. You want to understand, okay, what is priorities to that community at that point in time. So for example, I was talking about maternal mortality, right? I was talking about maternal mortality the other time. And then the reason why I'm really emphasizing like maternal mortality is because maternal mortality is very predominant, especially in Nigeria. I think in 2023 we had about 75,000 maternal deaths, which was like a lot. And you know, by statistics, we understand that 70% of maternal mortality occurs in sub-Saharan Africa, right? So, and Nigeria makes up close to 2% of the total world population, you know, but it still contributes to 10% of global maternal mortality. So that's it. So when you're talking about maternal mortality in Nigeria, in the Nigerian context, it's a priority health issue, right? It's a priority health issue, and it's something that should be paid attention to, right? If you're looking at the health issues from a global perspective, if you're looking at non-communicable disease, for example, cancers, you know, and all of that, you see that they contribute to more than 71% mortality all over the world. So if you're talking about NCDs, for example, that's like a major thing to pay attention to, right? That's like a major priority issue. So what I'm trying to say is that you really want to understand the health needs of that particular community. You want to understand the health needs of that particular community so that you'll be able to like profile solutions to, you'll be able to profile like solutions to the proper accurate solutions to the problem that you're trying to solve, right? I want to really encourage everybody on this call that we should not be people who just solve problems blindly. So for example, people just think that you could solve a problem by just being passionate about the problem, right? For example, and sometimes based on people's experiences, maybe somebody, I know somebody that started a mental health initiative because he lost somebody very close to him to depression, right? And somebody might be passionate about maybe hypertension because maybe something happened to somebody close to them and all of that. So, but what I want to re-emphasize here today is that passion is not enough to solve a problem, a healthcare problem. Passion is not enough. You need to really understand. You need to do design thinking, and part of design thinking is empathy. Empathy is you being able to see from the eyes of the people that you want to solve the problems for. That is very, very, very critical. That is very, very critical. So, part of also trying to solve this problem when you want to really understand the community and their needs, right? You also want to understand the people, right? You want to understand the people who are most affected by the problem that you're trying to solve. That is very important. You want to understand the people who are most affected by the problems that you're trying to solve, right? So you want to listen to them a lot. You want to understand their belief system. You want to understand, because these things are very, very important, so that you'll be able to know. You also want to understand, okay, what's the socioeconomic status of, you know, the group that are trying to solve the problem for, right? It's really important. It's really important, right? So when you've done all of that, you want to ensure that you now build a team of people who can solve that problem. And I'm going to stress this a bit because from what I've observed in the past, I realized that a lot of people who want to solve problems just build a team out of like familiarity, or I know this person, come on the team, I know that person, come on the team. When you want to really solve a problem, you want to ensure that you build a team of people who are not just connected, who do not just like resonate deeply with the problem, but who also have the capacity to proffer solutions to the problems that you're trying to solve. It is very important. It is very, very important, right? And I would also recommend that when you're building your team, it's important to also put every stakeholder into consideration. So if you're trying to solve a problem for a community, there's one thing that is really critical. You want to ensure that you engage the community leaders, the community stakeholders as much as possible, right? The community stakeholders, you want to engage them. They could be like the healthcare professionals in that community, the religious leaders in that community, because sometimes it is the mindset that is instilled, the minds of people when they go for their religious activities that actually causes some of these problems, right? So if you're trying to solve that kind of problem, for example, there are people who do not believe in blood transfusion, there are people who do not believe in taking drugs. Like there are some, religious groups who do not believe in some of those things. So if, for example, you're trying to like profile a solution that has to deal with something like that, that means that you have to really engage the religious leaders, for example, right? And you like I said, like also the community leaders. And when you're building your team, right, it's also very important that you build a team, like I said, build a team of people who are very capacitated to solve the problem that you're trying to solve, right? Build a team of people who are very capacitated to solve the problem that you're trying to solve. And your team, especially if you're trying to solve like a healthcare problem, you want to, depending on the kind of problem that you're trying to solve. For example, if you're trying to solve, if you're trying to address maternal mortality, you want to ensure that, for example, as a medical student, yes. But the truth is that you don't know so much. No matter how much you think you know about maternal mortality, there are professionals who know a lot about maternal mortality because of their experience, right? So, for example, you might want to reach out to somebody who is like a consultant obstetrician and gynecologist to be a part of your team, right? Such that as you are trying to design the solution, as you're going through the process and all of that, they will be able to put you through a couple of things and also identify errors in the design of your solution. That is very important. And another thing that they could also do is that they could also help to facilitate partnerships. For example, if somebody is a gynecologist or an obstetrician, most of the time, more often than not, they belong to a group of gynecologists. So some of them belong to the West African Society of Gynecologists and all of that. So because of that, they're able to facilitate some partnerships for you. And that's why I'm stressing this more, because a lot of people think that when they want to solve a problem, they need a lot of money. But many times what you actually need is resources. You need relationships. You need people to work with, and you're going to solve that problem. You're going to be able to solve that problem. So like I said, you want to ensure that you have like healthcare professionals who are very, 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 very vast in that direction, right? If you're trying to solve a problem that is, let's say, something about infectious disease and all of that, so you could get an infectious disease consultant to be a part of your team. These things would really help you. You want to build a very, like I said, a very capacitated team. A very capacitated team. It's very important to put all of these things into perspective. It's very important to put all of these things into perspective. And I should also mention that you also want to be very intentional about documentation. Now, the reason why documentation is very necessary when you're trying to address a particular healthcare problem is that, I'm sorry, so that I don't overshoot. Is it okay if you just let me know how many minutes I have left, maybe on WhatsApp or something, so that, yeah, thank you very much. So, yeah, so like I was saying, you you also want to really document the solution that you have been able to provide to that particular problem. And the reason why this is necessary is so that you can scale, right? Because many times when you are trying to solve a problem, you might not have enough financial resources to address that problem. But when you document what you have done, right? And like I said, you go through all of these processes, you understand the problem you're trying to solve, you understand the people that are trying to solve the problems for, or the problem for, and then you document it properly. And when I'm talking about documentation, I'm not just talking about you having pictures or having videos. I also recommend, if it's possible, for you to create an impact report, right? An impact report. When you create an impact report, you could, even if you just did like, you've not been able to do so much, maybe because you are restricted financially, you can document that and send it across to organizations who can help to scale your work. So, for example, if you're doing something around heart health or cardiovascular health, you could do something in your community, and then when you're done, you put all the pictures, all the videos together, create like an impact report, talk about like how much you were able to raise, and then talk about like you should have impact metrics. The impact metrics, how did you measure your impact, and all of that. Put all of that into like an impact report. Why you're trying to solve that problem. So, for example, if I'm trying to solve the problem of maternal mortality in Nigeria, it makes sense, right? It makes sense because like Nigeria, when it comes to maternal mortality, we're not doing well. We're not doing well. And then, like I said, so you could send this to bigger organizations or bigger institutions that can help to scale your work. So, for example, like I was saying, if you're doing something around heart health, you could put all of that together into an impact report and send it to maybe the American Heart Association, for example. And trust me, if there's one thing I want to recommend, is that do not be afraid to shoot your shot, right? Don't be afraid to shoot your shot. So when you do that, just try to like identify like stakeholders. LinkedIn is a very good platform to connect with people. When you identify the stakeholders, put all of that together, talk about what you've been able to do in your own community. Many times they would resonate with what you're doing, and they would even appreciate what you're doing. So it's possible that by the time you do that, it's possible that they support you with resources, like financial resources. Some people have gotten some form of funding by just doing that. It's possible that they spotlight your work. So, for example, imagine that you're doing something in Makoko, and then your work was spotlighted on that kind of global platform, right? It just really helps to scale your work, and people see, some form of credibility in whatever you're trying to do. So that is also very important. So that's why I was trying to stress the part of documentation. I understand that many of us here are really doing our bits in our communities, but you want to be very intentional about documenting your work and putting your work out there, and also shooting your shots when you should, right? When you've done something. If you're doing something related to antimicrobial resistance, for example, there are lots of organizations that focus on antimicrobial resistance. There is React. I know React Africa. Yeah, there are a couple other organizations like that. I'm sure if you check the internet, you're going to see some of them. So you want to be very, very intentional about documentation. In fact, there are also local organizations. By local, I mean organizations that's in your own country, for example, that you could forward some of these things to. Or if you know somebody who's like an expert, maybe somebody who works at Ministry of Health or something, you could pitch yourself and talk about what you've been able to do in your own community, and you never can tell how much this could go, honestly. This is really, really important. This is really, really important, especially because of the peculiarity of our audience, right? And so I'm charging you now that if you have a problem that you want to really solve, you want to ensure that you understand the problem that you want to solve. You want to understand that problem very, very, very deeply. Then you want to understand the people that are trying to solve the problems for. Right, you should not just be carried away by the problem that you're trying to solve, that you forget that you're actually trying to solve that problem for a people. And then you want to build a very strong team. A strong team is a team that is capacitated, a team that has all the people needed to profile or create the solution that you're trying to create. That is really important. That is really, really important. Right. And then when you've done all of that, you know, you also want to ensure that on your team, you have people who also help, who would also help to like document and all of that. And that's the beautiful thing about having a team, right? When you have a team, what you're doing is that you're putting together the strengths of the individual team members and putting all of that together, harnessing all of those resources and using it to meet a particular health need. You're using it to meet a particular health need, right? So when you've done that, you now want to design a plan to solve that problem, right? You want to design a plan to solve that problem. Now, your plan would now depend on what you have done, right? The kind of consultations that you've made, you've spoken with the people in that community, you have you have done like a community needs assessment and all of that, right? So you can now determine, okay, what is the best way to solve this problem based on the information that we have. But many times the mistake that most of us make is that we just go, if we just identify a problem and then we're just like passionate about it. So for example, I mean, I've been on ward rounds before, clinics, and then sometimes a patient comes and then, you know, you're just very moved, right? You know, and in a way you might begin to get emotionally attached, right? But then you cannot just go from passion to execution. You can't just say that, because like you are emotionally attached to this person or you're passionate about this problem, and then you just go and execute a project based off that. That is not going to work, right? So like I said, the plan that you're going to determine, the plan that you're going to design will be determined by the information that you've garnered in your community health assessment and the other consultations that you made. So you can now decide, okay, we're trying to solve this problem. Should we do like an educational campaign, for example? Should we do a screening, for example? Should we pay attention to advocacy, for example, and all of that? So you will now decide, okay, what's the accurate intervention to address this particular problem? What's the accurate intervention to address this particular problem? Right. So you can now determine that. I'm aware that the antimicrobial resistance club is currently established at a couple universities. I know of Obafemi University, Ladoke University of Technology, my school. I know of Babcock University and a couple other universities like that. Like I know of Benue State University and a couple other universities like that, right? And I know that one of their key interventions is like educational campaigns, right? They do a lot of educational campaigns and all of that. So, like I said, you don't just jump from passion to execution. You want to first understand the problem you're trying to solve, the people that are trying to solve the problem for, and also now design like a solution that is befitting for that context, for that community, for the people that are trying to solve that problem for. That's really critical. The next thing is when you're designing your solution, you want to streamline it, right? And that's why, like I said, it is very important that you do a lot of community health assessment. You also like try to engage the stakeholders in the community. So if, for example, if your intervention is something around, if it's probably an educational campaign that you're trying to do, you now want to check, right? What kind of language do they understand the most in this community, or what kind of language they resonate with? I mean, the people that are mostly affected by that problem that they're trying to solve. So I know. I think it was. I've forgotten. I'm trying to remember. I think it was AAA. Forgotten the what's it called now? Something against antimicrobial resistance, Alliance Against Antimicrobial Resistance by Yusuf Babatunde. Yes, I think there was a time they what he did was that they were trying to address the problem of AMR, and what he did was that they just like designed like content in different languages, right? And that's like a major thing, because when we're talking about like addressing healthcare problems, we also have to talk about language barriers. That is really important. That is really important because many of these problems have to have something to do with like you know, doing a lot of like health education and all of that. So you also want to put that into perspective. But like I said, you will not really understand this if you have not done the work, if you've not engaged the people and all of that, right? The last thing that I would say, because of my time, I think my time is fast spent, is that you want to, when you want to create change, when you want to solve a problem, you want to have impact metrics, you want to have measurement metrics, right? So at the end of the day, how are you going to measure your impact? How are you going to evaluate what you have done? Are you going to evaluate it based on the feedback that you get? So for example, you could conduct a what's it called now? You could conduct a survey after you've done. If for example, if it was like an educational thing, you could conduct like an impact survey and a survey after, such that you know if their knowledge has improved about that thing. So for example, if you're trying to solve a problem that's related to like infectious diseases, and then you do something that has to do with like health education, you at the end of the day, first of all, you want to do like a pre-assessment, right? So that you can evaluate the outcome of the problem and the solution that you're trying to proffer, right? So, and then when you're done, you're not going to do like a post-assessment survey to evaluate if they really, really, you know, benefited from your solution. That is very important. I want to really encourage everybody here. I know that most of us are medical students, and most of us might not exactly have the financial resources to address some of these problems that we're very connected to. But I want to encourage you to do something today. Like start doing something today. You trying to understand the problem from a global perspective is you taking action already. You trying to talk with stakeholders about that problem that you connect with is you taking action already. So I want to encourage everybody to really, really take action, to do something, be part of the movement, be part of the change, be part of the solution. Don't just be an onlooker. Do something. Do something. You can do something. You have what it takes. You have what it takes to change the world. I want to appreciate the leadership of the team once again for the opportunity to do this. Thank you so very much. I believe that with all our collective efforts, everybody taking responsibility in their communities, we can change the world. Thank you very much.
Wow. That was a very wonderful session. Like, there's no way you're going to tell me that you didn't learn anything. I learned a whole lot. My notes is filled. Thank you so much, Mr. Prince, for that very wonderful session. I'm sure you guys have confirmed what I said at the beginning, that there's no time I listen to him speak that I do not learn. So from my own notes here, I'm just going to reiterate some few things I picked up. So if you're going to be a change maker, you have to understand the problem you're trying to solve. You have to understand the people that are affected by the problem you're trying to solve. And when it comes to solving problems in a community the passion you have is not enough. You have to take action, and design thinking is needed when you're curating a plan to solve that problem. Then the solution you are bringing, is it systemic? Is it replicable? Is it sustainable? So I'm sure a lot of you to have other field notes, and I'm sure you have questions you'd like to ask Mr. Priest. But the question and answer session is going to come just after we have our next speaker. So for everyone with questions, you can just put your question in the in-call messages, and after the third session, we are going to attend to all your questions. I'm sure Mr. Chris is still with us, so he's going to take all your questions. So just drop them in the chat box. When the time comes, you can raise up your hand. But we would actually prefer you leave your questions in the in-call messages or the chat box. So thank you so much, Mr. Chris. So moving on, I'm sure most of us know this is a partnership between. This initiative is formed as a result of a partnership between two organizations, which is NiMSA-EOhealth and EOhealth. And we've heard from the director of NiMSA-EOhealth about their mission, about their aims and objective. And I think now is time for us to listen to a representative of EOhealth who is going to talk to us more about EOhealth so we can better understand EOhealth. So with us today, we have the founder of EOhealth, who happens to be my own Oga, my own friend, and a whole lot of other things I will not mention before, so you won't be shy. So please, let's all put together our hands, our emojis, as we welcome Mr. Owolabi Emmanuel, the brain behind this initiative and the founder of EOhealth. So, sir, you have the floor now, and your slide will be coming up soon.
Wow, thank you so much, everybody. Can you hear me clearly?
Yes, we can.
Yeah. For me, it has been a very beautiful session. I have learned quite a lot, starting from the NiMSA president to Ms. Christine Ferdinand, of course, our keynote speaker, President Nige. I definitely know it wasn't going to deliver below standard. It was definitely going to go even top. I mean, there's a lot of things that you mentioned are things that people, let's say, like person like myself, who are also interested in solving problems, all right, would always ask me. So I got one of those questions today. And yeah, I received quite a number of answers from what he said, just as also let's without asking similar questions, that's the reason in particular that we have this kind of let's say empowering session as part of our onboarding session, because it's going to change, it's going to create the mindset that leaders, social impact leaders, persons that have made changes through change, go through and what they know. And thanks to the speech from basically once again, thank you so much, Sarah. Kudos to you on that. Yeah, quickly, I just want to quickly brief you on what you have said about, because it's very, I'd say, necessary for you to know who you'll be working with for the next So can you see me?
Yes, we can hear you now.
Sorry about that. All right. Yeah, introduction. Yeah, it's a pleasure to be here to share with something. To share with you something that is very close to my heart. EOhealth. Yeah, I've chosen myself as the founder of EOhealth, the youth-led initiative that is bringing to you, approach to healthcare education, access, and advocacy. Next slide. Yeah. Also, what's our vision? So, what we envision is a world where health is straightforward and accessible to all. All right. And we believe that no one should be left behind because of where they live or what resources they have. Our goal is to empower individuals and communities by making health education and health knowledge services both relatable and reachable. Right. And we do this through the education, practical innovation, and inclusive healthcare outreach. So these are basically the things that we do and contribute to our vision. Next slide. Yeah, so what is it? What says, I mean, is on our track, all right? So that'll be our mission is deeply rooted in reshaping health and wellness through a range of impactful initiatives. We provide accurate and practical health education using webinars like this one, community talks, digital media, and grassroots outreach. So we try our best to empower from the bottom to the top, all right? And whether it's creating awareness or around preventable diseases or hosting digital health campaign, it is driven by belief that knowledge saves lives, all right? Because of my time, I would have expressed myself in different areas, but I believe that as medical inclined personnel, you already understand the essence of health education, especially in a community, in a big community like Nigeria. Yeah, that's like. So, what exactly are our objectives? So I'll be classifying objectives to first networking. So, but we don't stop at information alone. We take action. Our team is committed to promoting sustainable health practices through hands-on community engagement, collaborations with medical students, partnership with healthcare professionals and organizations. Basically, we're living by what we've written down, and what we follow is clearly here, and you can see practically from what we do. We aim to make healthcare experiences seamless, especially for those in marginalized communities. So one of our most important goals is to build a network of passionate medical students across medical schools, a community where collaboration, mentorship, and professional development are nurtured. So, so now the essence of EOhealth, or let me say one of the objectives that we want to achieve or we've been achieving, is that we want to become a medical student just like yours, all right, where everybody finds EOhealth as a niche or as a hub where they can be empowered, where they can carry out the activities related to health, of course, and be able to like reach out to underserved communities. So EOhealth creates opportunities for students to gain real-world impact through volunteer programs, community outreach, and innovative health education projects. A lot of students, medical students, or in fact, not even medical students alone, public health students, nursing students, lots of persons who are volunteering in health have been able to get nurtured, empowered, get better at delivering our mission basically. And we don't see it as our mission, we see it as, so far you understand and you're ready to be a part of it. We all see it together as our mission. All right. So what I say to volunteers that we work with is that don't see it as Emmanuel's business. Don't see it as this is Emmanuel's project. All right, see it as my project. So the only thing or the only attachment, or let me say the only affiliations here or relationship here is that we're only working through a platform or working through an organization or a system that makes it easier for us to carry out our work. All right. So you as an individual can represent yourself in your school and under the name EOhealth, all right, through our nurture, through our, let's say, bring up and whatever some resources that we can give to you, able to carry out important, objectives that we can able to highlight here, right? So next slide. So another aspect to outline here is volunteerism. So in everything we do, volunteerism remains at the core. So we believe that you'll be surprised that, how does the earth operate? The earth operates, and we've been operating for past for up to 2 years now. So we're yet to be 2 years, but like we're going close to 2 years now, all right, on volunteering. All right. So yeah, we provide an opportunity for you to volunteer and to learn, to grow, and to also have an evidence. Let's say if you're someone that is looking for a CV or trying to ask your CV, looking for information to volunteer in, it's a home for you to build yourself and of course prove what you've been able to learn. So we believe that commitment to serve, especially in resource limited areas, is what truly creates change. We've empowered students and young professionals to extend healthcare support to those who need the most, reaching people in rural villages. Reached out, tech innovators and NGOs working together to co-create solutions that promote healthier living This partnerships helps us grow after our efforts and open opportunities both locally and globally. So next slide to our time. Next slide, please. I think I have like 1 minute or thereabout. Working with structured growth, and we aspire to achieve global recognition by contributing meaningfully to health transformation, validating our work, and young people who want to be part of the solution. Next, is that the end? All right, so this is to you all. And speaking of young change makers like you, we're so proud of everyone who made it into the NiMSA-EOhealth ViHLERT training. Congratulations once again. We would love to celebrate this moment with you. Feel free to share your excitement about your acceptance. Screenshot your acceptance email, tag us up on Instagram or X, and tag us up on LinkedIn. We'll be happy to repost and celebrate you because your success is part of our story. Feel free to also add it to your LinkedIn profiles that, you're taking social training at social time, everything you want to do, you have to celebrate you and recognize you. Thank you, everybody. I do hope that you enjoyed this session throughout the rest of the week. Bye.
All right, thank you so much, Emmanuel. I'm sure from what has been shared, most of you now have a clear insight of what EOhealth is about, what our mission is, and the steps we've been taking to attain our mission to reach our goals. So thank you so much, Emmanuel, for the insights you've provided into EOhealth. And I'm sure you guys probably picked up one or two lessons from the things you do. So that's also very nice. We encourage you to continue to practice the things you've learned. So now is the time for questions and answers. So if you have any question for any, let me confirm we still have Mr. President with us. Okay. We don't have Mr. President with us presently. How about Miss Christine? Currently, we don't have Miss Christine with us. Okay, so if you have questions for either Mr. Praise Ogunleke or Mr. Owulabi Manuel, just raise up your hand, or you can also drop your questions in the chat box. Okay, so I can see 2 hands raised presently. So Olatunji Adetunji, I'll be giving you the mic now. So once you get the mic, you introduce yourself, you tell us who your question is directed to, then you can go ahead and ask your question. Okay. Okay, so you have the floor, Olatunji Adetunji.
Can anyone hear me?
Yes, we can hear you.
Okay, so first of all, I want to say thank you for this opportunity and for this training. My name is Chinji, and I have a question. It's not really maybe a medical question per se, but still it's a question. The EO in EO Health, what does it stand for? Okay.
All right, so it's a question I can answer, but then I'll prefer Mr. Emmanuel to answer that. So I'll just give him the mic again, then he can answer. So, Mr. Emmanuel, some would like to know what the EO in EOL stands for.
All right.
Okay, you
Thank
have the
you.
mic now.
All right, thank you. EO Health, very simple. Emmanuel Owolabi. Yeah, so you can see that if I would have loved to narrate or to tell you how your health idea came about, but I think that's not part of my topic today. However, just know that it's Emmanuel Owolabi Health. Thank you.
All right. Thank you very much, Mr. Emmanuel. So, to G, I'm sure you got the answer to your question. Okay, so now moving on, I think the next hand raised is you still have the opportunity to ask your question. So if you want to ask a question, just raise up your hand. I'll pick it up then. You'll be given the mic. So, okay, Jola Somi Uluafemi. Let's take your question. A minute, please. Okay, so Jola Somi Uluafemi, you have the floor and you can ask your question.
Okay, all right. Good evening, everyone. Thank you very much, our moderator. I want to appreciate the organizers of this training. Thank you for this great initiative. I also want to appreciate the guest speakers. Thank you in person of the NiMSA president, Ms. Ferdinand and Dr. Praise Ogunleke. So my question is directed to Dr. Praise Ogunleke. I don't know if you can hear me now. Please, can you confirm that, sir?
Yes,
I mean, Dr. Praise.
Okay, I would hand him the mic.
Hello, sir. Yeah.
Okay, so Mr. Priest, can you please confirm if you can hear Jola Somi?
Yes, I can hear you.
All right.
Okay. Thank you, Dr. Praise Ogunleke. So my question is that you spoke about while you were training us, you spoke about research as a medical student. So I just want to ask that as a medical student who is always passionate about a particular field, I mean research about a particular field, especially especially an infectious diseases. So because over here, I mean in the MSc that I'm in, the environment is not really encouraging or conducive or propelling to post like it's not fostering research and some other things. So I just want to ask if there are any practical insights that you can share or any step that such person can begin to take to set him or her on the path of ensuring that his or her research is properly done. I mean, things to look out for, things to put in place to ensure that such student is able to carry out the research, because it's something that I'm very much interested in, but I don't have should I say resources, manpower, and some other things associated that can help me with that. So I would like you to share some with me, sir, and every other person that would want to listen. Thank you, sir. I'm done.
All right, thank you very much. Please, I'd like to confirm if you can still hear me very clearly.
Yes, sir.
Yes, sir, we can hear you.
Yeah, thank you very much. So I think I should show my face a bit. So thank you very much for that interesting question about research and participation in research as a medical student. Have to be very honest with you. I think that when we talk about research, many times we talk about the knowledge of research, we talk about publications and all of that, but I think that the most important thing about research, or let me say the primary thing everybody has to understand about research first is the mindset of the researcher. I believe that an emerging researcher should, or a researcher to be, should have a mindset. There's a mindset that one must develop or one must have in order to be successful as a researcher. I'm still learning myself, but from what I've learned in the past, I think that number one, you have to really understand what you want to use research to do. And that is really critical. Like, what exactly are you using? Do you want to use research to achieve? For some people, they want to do research because they want it to be like maybe it's like a career path that they want to pursue. So for example, it's possible that I want to be a clinician scientist, a physician scientist, or just want to be a scientist, right? Even after school. It could be that you want to do research because you want to do postgrad. maybe when you're done with school, you want to do a master's or you want to do a PhD, for example, and you need research experience. You could do research because maybe you're seeking opportunities for fellowships outside the country and all of that. So it could be that maybe you want to do residency. If you want to do residency, for example, in the United States, I think that you need research. And I think it depends on the specialty as well. So some specialties most specialties, if not all specialties, have like a minimum requirements when it comes to research, like number of publications that you should have and all of that. So what I'm saying is that seeing it from this perspective, having a fundamental why as to why you want to do research is very critical, because if not, you might find yourself getting frustrated at the end of the day, or even when you're barely getting into it, right? And then you also have to understand that research is first hard before it becomes easier. I'm not even going to say easy. I would say easier, right? It is first hard. In that, when you first start research, it is really going to be hard. And I'm not trying to miss words or trying to, I have to tell you how it is. It is hard. But then the more you do it, the better it gets. Now, I just wanted to say all of that to just give you a better perspective on how to approach research, to be honest. So how to do research as a medical student. What I would say is this, like I said, have a fundamental why, because when you have a fundamental why, you understand how to go about it. So for example, if you just want to have a few publications because you want to do residency, then you know that you might not have to commit as much time and effort like your other friends who probably want to pursue a career in research. And that's also going to help you to measure your expectations. So you're not trying to have like 200 publications, for example, because it's not like you want to pursue a career in that direction. So what I would say is that when you want to do research, right, from my own this is what I would recommend. Number one, you want to devote yourself to consistent learning, right? You want to devote yourself to consistent learning. And by this, I mean that you want to, from now, you want to start learning something, because you know what I've come to find about research. Research is like collaboration. You need to work with people. You need to work with editors. You need to work with data analysts. You need to work with other writers, and all of that, depending on what exactly you're trying to do. It's like collaboration, and that's one thing you can never take away from research. But a lot of people want to get started, make a mistake of trying to just walk up to somebody and say that, oh, I want to learn research. No, you want to make effort first. You want to do something. Take a course, right? Take a course. Have courses that I could recommend. There's this author aid course. It's very popular. You could check it out. I think it comes out at some point of the year. I'm not sure if it's out now, but just like keep tabs on that. Author aid. There's is it Global Health Learning now? They have a course on research writing as well. I could share links with maybe the programs coordinator after the call. The person could share with you. There is also Elsevier. I'm sure some of us are familiar with Elsevier. Elsevier wrote some of the texts that we are reading. For example, Elsevier, for example, wrote Grey's Anatomy, right? So, right, they have like courses that you could take, as a student, and you want to start with that. What I'm saying is that you want to have something at first, so that by the time you're walking up to people to say that you want to learn research, you want to do it, have something to present to them. You're bringing something to the table, because at the end of the day, really, it's all about what you're bringing to the table, right? So when you've done all of that, or when as you start all of that, now I don't want you to get caught in a mental trap, and that trap is you want to learn everything, you want to figure everything out before you start doing research. It is never going to help. What you want to do is that as you're learning, as you're taking courses here and there, you want to ensure that you're also you're applying what you're learning, right? So for example, if you're taking a research course and you're learning how to search databases, right? Maybe how to search PubMed, for example, you want to try to go to PubMed and apply what you've learned, right? That would really, really help you. I've realized that research is best learned by doing. Like, you have to be actively doing it. When I first started, I took like 3 courses back to back. Like for months, I was just taking courses here and there, had a lot of jottings and all of that. But at the end, I could not really recall most of those things because I was not applying the things that I had learned. So what I'm saying is that even as you're taking the courses, you want to ensure that maybe you're part of a team or a group of people who are also maybe enthusiasts, and you're applying the things that you've learned. That is really important, right? And then I would also say that just really talk about it, like talk about your interest. You want to do research, you want to learn research, you want to understand research. Even if the interesting thing is that it's collaboration and you don't need to collaborate physically. There are people all over the country, medical students, medical doctors. Go on LinkedIn. LinkedIn is a very fantastic platform. Go on LinkedIn. You're going to see a lot of people who are doing research. And then you just need to reach out to people and tell them that you want to be part of their for upcoming projects. Talk to them about your interests and all of that. And then if you have, especially if you can write, right? And before you walk up to anybody, let me be very fast because of time. You want to ensure that, for example, you know how to write, right? You know how to cite, like, reference articles and all of that. You know how to do like in-text citations. You know how to search databases. You know how to avoid plagiarism. Like, those are busy things, right? When you've mastered all of those things, right, you can now start working up to people and tell them that we want to be part of their projects. And then tell them, your interest. And let me also say this, when you're getting started, don't be too streamlined. I understand that, for example, somebody might, some of us have that like level of clarity. And even as a 300 level medical student, for example, you know that you're interested in neuropsychiatry or you're interested in infectious diseases. But what I would recommend is that you want to first of all understand you want to have knowledge about research. You want to hone that skill, right? So you don't want to now say, oh, anything that doesn't have to do with infectious disease, you're not going to accept, you're not going to be part of those projects. No, you first of all want to understand how to write, right? And then you need projects, similar or not, or dissimilar projects, to be able to put all of that into practice. That is really important. So, like I said, reach out to people, really, like reach out to people. That's just it. Like, just reach out to people who you see are doing research, and then you never can tell. And let me just say this lastly, because there's no time, right? I realized that really, when it comes to research, it's more about the collaborations. Trust me, it's not really about you doing so much work. Of course, you're going to put in the work, but then it's more about like how many collaborations you can be part of, how many teams you can work with, and all of that and all of that. So you want to put all of that into perspective. And when people bring you on board, like maybe on a team, you want to try to do excellent work. So those are some of the things I would just like say. We could go on and on to talk about these things, but I think I'll just like put a pause here so that we don't take too much time. I hope I've been able to answer your question.
All right, thank you very much, Mr. Praise. Jella Somi, are you okay with the answer you got?
Yes. Thank you very, very much, sir. I
All
really
right,
gained a lot of clarity with that. Thank you, sir.
you're welcome. Moving on. So, okay, there's a question in the chat box that I would like to address. This should actually be addressed by Miss Christine, but unfortunately, she's not on the call presently. So the question says, my question is directed to the National Director of the NiMSA-EOhealth team. Given the increasing importance of emergency preparedness, both within and outside the medical field, are there any plans to organize a comprehensive practical program that will physically orient and train students on how to handle emergency situations? Well, okay, I can't really say much on our behalf, but I know there are great expectations we have of them and more to come from the NiMSA-EOhealth team. And this initiative is just one to begin with. So I'm sure they have other things in stock for medical students across Nigeria. So let's just look forward to that. Okay, our time is fast spent, so I would like us to move on to the next thing, which is participants' expectations and training overview. So for introduction's sake, I'll just reintroduce myself to you guys. My name is Olalikon Samuel, and I will be serving as the program coordinator for this initiative, for the ViHLERT initiative. So what are the expectations we have for you, and what does the training entail? So first of all, I would like to say, I would like to welcome all of you officially to the training program, because after today's session, it's straight into the training program. So far, we have students across 38 universities in Nigeria, and we are actually encouraged by this because it shows us that there are a lot of young people out there that are eager to learn, grow, and make a difference in their communities. And this is one of the driving force or driving idea in this program. Also, the purpose of this training is to educate medical students on the importance of health literacy. Like, there's a lot of misinformation outside there, or things that people don't even know, misinformation and lack of information. So it's to educate medical students on the importance of health literacy and emergency response. I think we've talked about that well enough today. And also to empower those of you who have signed up for this program with the knowledge and skills you need to help others. At the end of this program, our main goal, or what will happen, that we can say, okay, we are successful with this initiative, is to have trained what I'll call foot soldiers in quotes. And these are basically young and capable individuals like yourself who would help spread the right health information, correct misconceptions, and also respond effectively in emergency situations as the need arises. So it's a 6-week training program, but the actual training and learning will be for 5 weeks, and there are going to be 10 virtual sessions, meaning 2 sessions on the same day in a week, 5 weeks, 10 virtual sessions, and they're going to cover various topics in health literacy and emergency response. And we've put together so much resources to make sure we get experts in this field, so you can be very sure you'll be learning from the best. You get, I'm sure some of you might have seen the speakers we'll be having around. There was a flyer to announce the speakers, so I'm sure you guys might have seen that. And also, we'll be sharing the full training schedule with you guys after this call, so all of you can go through and properly prepare ahead. Okay, to be sure that someone out there can hear me, can you just give me thumbs up or something? Okay, yeah, thank you very much, Abraham. So now let's talk about what we're expecting from you. Like I said earlier, we've put in a lot of effort, a lot of resources, time, and planning to make sure this training is possible. So and it's free. So the only expectation we have of you, or let me not say the only expectation, the best way for you to reward us for everything we've put into making this possible is just for you to show up. Make sure you're always engaged and give your best. That's all. That's the major thing we're asking from you. Just show up for your classes, engage, ask questions, and give it your best. And also, at the end of this training, certification is going to be given. But I want you to know that, fine, quite a lot of us started this together, but it's sad. It sounds unfortunate, but the reality is, at the end of this program, there may be people that will not be certified. And why would that be? Because if you look at the structure of the program should be at least 10 hours worth of training session. So for you to be certified, you must have at least 8 hours worth of attendance. And this also means you must have attended at least 80% of all sessions, meaning for each day, you must be in the meeting. You must be in the meeting for at least 70% of the time the call or the session is going to run. And you may look at it that this is difficult to achieve, or it's quite strict. Yes, it's strict, but we want the certificate we will be given at the end of this lecture. We want it to be at the end of the training. We need it to be something credible. We need the certificates we'll be given out to be credible, because if you take a course online, you can't get certified for that course unless you've completed the course. And there are courses that you can't even get certified for it unless you've passed the course. So for you to pass this training and get certified, you must have at least 8 hours worth of attendance. This means you can't just come on the call for 1 minute and think you're done and you can just leave. And I need you all to share this with your teammates, because it would sound unfair at the end of the day when some will be getting certified and some will not be getting certified. So I need you to communicate this to your teammates. It's still going to be shared on the communication platforms. So you must have at least 8 hours of attendance for the training in total. So for the attendance to count, please make sure you join with a Google account that carries your real name. Don't join with an account that carries just your nickname or a name that is not yours. And if you're going to be joining with someone, it's even best for you to join with your own account. Let us know you're on the call. And we know emergencies can arise. We know there are times that, okay, for one reason or the other, you may not be able to make it to a session. So please make sure you inform your team lead, and the team lead is going to communicate to the organizing team at least 4 hours before each session. And the thing is, you can only get to excused absence throughout the training. You can only get to excused absence throughout the training. And also, to make sure to help you hold you accountable for each of the session, we're going to be sending a calendar invite with the session details. And the reason we are doing this is to make sure you get proper reminders. So when we send the calendar invite to your emails, make sure you accept the invite. Like, it's just a thing of you clicking yes or no. Make sure you accept the calendar invites and we can know, oh, you are. So that way, make sure you accept the calendar invite. It will also help you get notifications about the training so you don't miss out or forget you're having a training. And also, apart from all the things I've said so far, you're expected to be punctual for each of the sessions. Like, not like a session is supposed to start by 6, then you're coming by 6:30. That won't be allowed. That won't be allowed. That won't be encouraged. So make sure you're punctual for each session, sorry, and make sure you're active. Ask questions. Let the people that will be hosting the session, let them know at least there's this person I met while I was handling this session, and it may even be a gateway to an opportunity for you. Oh, maybe the speaker can just be like, because these are high profile people, you may just be like, oh, I like the question you asked. Would you mind messaging me after? Let's discuss this idea you shared. Let's discuss the solution you shared after. So make sure you're punctual, make sure you're active, and make sure you engage during each session. Ask questions, make sure you take notes. Like, there's this thing of, if you just listen to something, there's a tendency that you'd forget. But then if you put it down, even if you don't remember, you can always go back to it. And there are times that you're going to get assignments or group tasks. So be sure to submit them on time. And like I said earlier, we are going to share the full training schedule with you after the call so that you can plan ahead. And like I said earlier, make sure you engage, be active. Let us know there's this person that is part of this training program that actually stood out when the program was running. I mean, probably, maybe at the end, maybe apart from the certification you'll be getting, maybe we give out surprise awards, who knows? So there's only one way to find out if you want to be the person that wins it. And also, for each session, when you learn something, make sure you share with your audience online. It's you putting into practice the purpose of the training. Like, it's basically for health literacy. So when you learn something during the course of the training, share with people online. It's you actually like practicing what you're learning during the session. So I think our time is fast spent, so I'm going to leave it at that for now. Any other details will be shared on the official communication platforms, either directly to you or through your group leads. Okay, so I see some hands raised. Okay. Olatunji Adetunji. I'm going to hand you the mic now, then you can go ahead and ask your question. Okay, Tunji, you can ask your question now.
Oh, sorry, my hand was raised by mistake.
All right, that's fine. And Olatunji Rodiat, your hands are raised. So I'm going to give you the microphone now and you can speak. All right, Olatunji Rodiat, let's hear from you. Olatunji Rodiat, you have the microphone if you want to speak.
My hand was also raised by mistake.
Okay. Okay, I can see other hands raised. I would attend to everybody. Okay, Ephraim. Okay,
Okay,
Ephraim, you have the
good
microphone. Let's see.
okay, good evening. I
Good
wanted
evening.
to clarify something. So you talked about how there will be a link, more like an email sent to us, I think, for each activity. And then you talked about how we're supposed to accept or decline. So my question is it that at the beginning of the program or before the program starts, it will be sent or after? Because I just checked my mail and I didn't see anything. I said, let me just ask.
Okay, so as regards the meeting for the link, not everybody got the link for this meeting due to some technical issues, but we're working on fixing that. And I can assure you that by the next session, everyone should get a mail as regards the meeting link and every other details. And also, just for something I'll call two-factor authentication, the session details will also be shared on the group ahead of each session. So if you don't get the mail, you would have gotten the information on the group. And if you do not get the information on the group, your team leads would have gotten the information and please ask them to share with you. Also, if you don't get if for any reason, definitely it will be shared on the group. For maybe for any reason at all, you can't find it on the group or anything, reach out to any of the admins. They're going to share the session details with you. I don't. But everything is going to be provided this side of the session. Thank you. Does that answer your question?
Yes, thank you so much.
All right, you're welcome. All right, I can see Emanuela. Okay, Emanuela, I'm going to hand you the microphone now and you can speak. All right, Emanuela, let's hear from you.
Okay, thank you. Good evening, everybody. I just wanted to, I don't know whether to phrase it as a question, but also make it an observation of some sort. So the speaker, Mr. Praise, spoke about meeting the people where they are, or what I inferred from his conversation is meeting the people where they are. And you also spoke about the goal being creating food soldiers in the future generation of healthcare practitioners. So I'm wondering how exactly we can start now, aside from research and obviously this training that we're undergoing of advocacy for emergency response. Um, what else can we do to be foot soldiers, especially in schools like Tunji mentioned that are not exactly conducive to learning, sharing, gaining such experience? How exactly can we get involved in the processes or the programs? How can we bridge the gap? So yes, that's my question. Thank you.
All right, thank you very much, Emanuela. Mr. Priest, would you like to take that?
I'm so sorry. I didn't get the question. Do you want to take it again, please?
Okay, Emanuela, you can please go again.
Okay, sorry. My question is, how can we join the programs? For example, you are the head of I'm sorry, I didn't get the full gist of what you're the head of. I'm so sorry, but you're the head of a research thing. How can we get involved in programs not in our school, not in our schools? Because some of us come from schools that are not exactly conducive to this sort of learning and sharing and team building. Hence, why we have also joined this program. But how can we get involved more and become foot soldiers, bridge the gap? Because some of us don't just want to create initiatives, and yes, it is amazing to be like EOhealth and head of NIMSA era and all of that, but some of us want to do the footwork. Some of us gain satisfaction in doing the footwork. So how do we bridge the gap, or how would you advise we bridge the gap?
All right, thank you very much. I think I got it. Got your question. So what I would recommend is, honestly, I think that it depends. It depends on your school, because I understand that like some schools have restrictions, but I think that regardless of the restrictions, like there's always a way to go about things, right? So for example, if you're very interested in solving a particular problem or contributing to a cause, you can do that virtually, right? You can do that virtually. You could join teams virtually, contribute your quota and all of that, work with teams and all of that. They are projects that I'm a part of, and I'm not physically present, right? Because like the team members are not in a particular location, right? So you could do that. But if you want to do like more footwork, you want to do like the real work and all of that, like I said, honestly, I think it depends on your school, right? You could, for example, look out for initiatives that are closer to your environment. I'm not sure what school you are in, but you could like do a research, look out for initiatives that are probably are advancing the cause that you're passionate about, and try to like join them, right? And if you are not able to see that, you could actually start something. That's what I believe, right? You could start something. I know that especially for private universities, and there are usually like restrictions here and there, but I've seen a couple private, for example, I know that EOhealth is headquartered. I mean, is predominantly in Babcock University. I know of Bowen University as well. I know Afebapala University and a couple other universities like that. And I've seen that these people sometimes just have to like create something for themselves, and then they start something. So what I'm saying is that if you're not able to find an initiative that advances the cause that you're passionate about, and you don't want to do just like virtual work, you want to do like the groundwork and all of that, you could actually start something, right? Another thing I think that you could do, or you could explore, is that you could look out for organizations or initiatives that are advancing that cause in another place, right? It could be outside Nigeria, it could be outside your own environment. And then you reach out to them and tell them that you are willing to start some sort of like a branch in your own environment. I believe that almost every organization or almost any initiative would be open to that. I believe strongly. So for example, if you are in Afebapala University, I say you like what EOhealth is doing, I think you like to start something in your school. I think that they'll be very open to that. I think that they'll be very. So what I'm saying that you could also explore partnerships with already existing organizations that serve the cause that you're passionate about, right? And serve the cause that you're passionate about, and by doing that, you don't exactly have to start from the scratch, because the vision is already established, the mission is there, and all of that. They have a team, so they could even be willing to support you with resources here and there. So that could also be a way, right? Like I said, it really depends on the environment that you're in. But I think these are options that you could explore. Yeah.
Thank you so much, Mr. Priest. So, Emanuela, I hope you got that.
Yeah, I did get all of it. I did have a little bit of a follow-up question slash observation. First of all, I'm not shunting virtual work. I am also talking about virtual work as being part of groundwork because I am an avid writer. I would sit in front of my laptop anytime, any day, and just write about medicine or things I'm passionate about. So I'm not shunting it in any way. But you also spoke about the community that you are, like, not forgetting that you are trying to solve a problem for a particular community. And also I took sort of it's sort of like talking about passion versus priority. And that's why I also decided to ask about like research, like finding your ground in research options, because yes, there might be things that might be going on that I'm not exactly passionate about, but it's a priority for the community. So like, how do I face that mental battle of, should I join an initiative that I'm not exactly passionate about? I put in the work regardless because it's an initiative for the good of the people. But should I join an initiative that I'm not exactly passionate about to because I'm just starting out in research and helping and all of that? Or should I start from scratch with an initiative that I'm passionate about? Like, what are your thoughts on facing that mental battle? Thank you.
Yeah. So thank you very much for your question. I think what you're trying, just to be sure I got you correctly. So you're asking, for example, you're passionate about a particular problem, but that problem is not priority in the community that you're in, right? Like how do you navigate that, right? And then you also spoke about the fact that you're not exactly like shunting virtual options and all of that. I actually thought initially that you were not interested in like doing virtual stuff and all of that, because honestly, I think that you can do a lot virtually, right? I think that you can do a lot virtually. People are starting doing projects and then like bringing teams from all over the world and all of that. So I think that we just have to really adapt to that, because that's what a lot of people are exploring now. So what I would say is that if you are passionate about a particular problem, right, but maybe it's not exactly priority for that community, I think it's very important to ask, because like I said, the thing about design thinking is that it's not about the problem solver. It's about the people that the problem is being solved for, right? What that means is that you have to always prioritize the people that you're solving the problems for over yourself, right? You have to prioritize their preferences over your own preferences. So, for example, you want to solve a problem and then they prefer it to be solved in this manner. Let me give a very good example. So, there was a particular group of people, I think like an initiative, and then they went to a community and they saw that these guys did not have, these guys were always walking far distances to fetch water every day, particularly the women, right? And then they just came together. Oh, let's do let's do something, like let's create a bowl for them. And then they did that for them. And after a month, they went back to check and they saw that they had not been using the bowl. And then they now went to inquire from the people that they were trying to solve that problem for, like, what's happening? Like, we did this for you, you guys are not even using it. Like, what's happening, right? And I mean, that they should have done that prior to that time. And then the women now had to tell them that the reason why they always the reason why they were not using the ball was because in that community, the husbands lord over the women, like the men lord over the women. So a lot of control and all of that, you know, some abuse here and there. So anytime they wanted to fetch water, they had to walk like far distances. So that was like their free time. So that was the time they had to gist with their friends. That was the time they had to like be away from their houses and all of that. So what I'm trying to say is that the other time when I was talking about design thinking, empathy is something that is really critical. Empathy is something that is very critical. So it is very important that you put the people that you want to solve the problem for, you put them, you rate them more. Yeah, that's what I think. I think it's important that you rate them more. Let me give an example, right? Some of us at a point when WhatsApp updated their app, right, there was a way the status used to display, and then everything just changed all of a sudden. Then many people were not really cool with that, right? And I think a lot of people reported and all of that. So what am I saying? WhatsApp might have, I mean, they might have thought that they were doing us good, they were solving our problem and all of that. But the people who they were solving the problem for were not enjoying the solution, right? So I honestly think that one should prioritize what is priority to that community. Yeah, I think one should prioritize. But even if you think that you're not really like passionate about maybe the priority or what is priority in the community at the time, I think what you can do is that you could also do your own bits in solving the problem that you're passionate about, right? You could start to do something about what you're passionate about, because the thing is that times change, right? And what is priority now might become priority later, right? So I think that, that's what I think about your question. I hope I've been able to provide some perspective. Thank you.
Yes, thank you very much for the perspective. Okay, well, thank you very much.
Okay. Emanuela, I think I can understand that you still have a follow-up question. So, and I think most likely Mr. Priest would like to provide more insights, but we would have to save others' time. So, Mr. Priest, there's someone asking in the chat box. Mr. Priest, please, can I get your phone number, because I am a beginner in research and I am looking for a mentor since I was told it is mandatory to have one. Is that something you'd be open to?
Honestly, first of all, I really appreciate your courage. I think it takes some level of courage and confidence to even ask, right? And I really appreciate that. Um, what I can afford at the moment, because my schedule is quite demanding currently, so I might not be able to promise that, honestly, especially the mentorship part. I might not be able to promise that. But what I can do is I could share, like I said, I could share links to courses that you could take, right? And yeah, I think I can do that. I can, share links to courses that you take, and if I am available, like, we could just like, you could share like feedback with me, maybe like once in a while. But I honestly don't want to promise, right? So yeah, feel free. Like, you could get my contact from Mr. Emmanuel or the programs coordinator. It's fine, right? It's perfectly fine. I could share the links with you. But like I said, I might not just be able to like promise the mentorship part and all of that. But I think I could just share more comprehensively how to go about it, and links to resources that you could explore. Yeah.
Mr. Praise, sorry, I don't know if it's on my end, but if you're trying to speak, I cannot hear anything. I don't know if it's just on my end. Sorry.
Okay, I think it's on your end because I heard him clearly. Is there any other person having the same issue? Just give thumbs up or raise up your hand. Is there any other person who couldn't hear him clearly? Okay, so I'm going to take that as a no. Also, Emanuela, I know you had a follow-up question the other time, so you can just put it together and send it to any of the admins on the group chat, and I'm going to get it through to him, and I'm sure he will be very happy to provide answers to your follow-up question. Is that okay with you? I'm not sure Emanuela can still hear us. Emanuela, are you there? Okay, so we'll take that as a no. So I would like to actually, we are supposed to give room for networking, like break everybody down into breakout rooms where you can like meet others, share ideas and share connections. But I think our time is far spent and we're just going to have to create another time for that. So thank you so much, Mr. Praise. We really appreciate you for the insights you've shared so far. And honestly, I must tell you, I've learned a lot from what you've shared. And what you've done today is a testament and a confirmation of what I opened with, that anytime I hear you speak, I actually do learn. But also, thank you very much to Mr. Emmanuel Owolabi for the wonderful insights you provided to us as regards EO health. That I think that might have sparked up something in someone to start something. Yeah, so let that be a form of inspiration to you to pick up and to start your idea. Just start something, or don't just start something, like be guided. Let there be a clear plan for what you're starting. But like they say, start it, do it afraid, and you will only get better at it. So thank you so much to our amazing speakers, and thank you all to everyone who have taken their time out to attend this session. We really appreciate your presence. So officially, the training itself is going to kick off on the 20th of April. So make sure you attend all these sessions. Encourage your team members to attend all these sessions. All right. So I wish all of you a very wonderful evening, and I wish you a successful and impactful training ahead. So make sure to share what you've learned on your Instagram, Twitter, LinkedIn. Share your experience throughout the training. That's allowed. So yeah, good night, everyone. Do have a wonderful evening. And if you have any question or any comments about the session, please feel free to drop your comments on the group chat, drop your feedback on the group chat. And remember, if you have any questions, the admins are there to support you. So now, here's my final goodbye. Goodbye, everyone. Do have a wonderful evening. Thank you.